Welcome back to the Dr. Jeffrey Tauth Heart Talk Show. Today's show is called Dr. Jeffrey Tauth Heart Murmurs Decoded. And trust me, it's juicier than your cousin's peach cobbler. So picture this. You're at your routine checkup, feeling great, maybe even bragging about your new workout routine, and then your doctor gets that look. You know the one. They're listening to your chest with their stethoscope, and suddenly they say those two words that make your blood pressure spike faster than a teenager's car insurance: heart murmur. Now, before you start planning your funeral and updating your will, let me tell you something that might just save you from a full-blown panic attack. Most heart murmurs are about as dangerous as a golden retriever puppy. Yep, entirely true, I can't make this stuff up. Let me break this down for you in plain English because medical jargon is about as helpful as a chocolate teapot. A heart murmur is simply an extra sound your heart makes between beats. Think of it like this. You know when you're listening to water whoosh through your pipes at home? Same concept. It's just blood flowing through your heart creating a little extra soundtrack. Your heart's basically got its own theme music. Here's the kicker, EQT. Up to 80% of kids have what we call innocent murmurs. That's medical speak for completely harmless and your kid is fine. Stop Googling worst-case scenarios at 2 a.m. Most of these innocent murmurs disappear as children grow up, kind of like how they eventually stop asking, "Are we there yet?" every 5 minutes on road trips. But here's what you need to know about the concerning ones, because knowledge is power, and I'm all about keeping you informed and alive. There are some red flags that should have you moving faster than Black Friday shoppers toward a cardiologist's office. If your murmur comes with chest pain, shortness of breath, or you're fainting more than a Victorian lady in a corset, we need to talk. Like yesterday. New murmurs in adults over 40 should always be investigated. I don't care if you feel fine. Your heart might be trying to tell you something important, and trust me, you want to listen. It's like your check engine light, but for your ticker. Loud murmurs, or ones that change when you switch positions, can signal structural heart problems. Your doctor is going to be listening to the timing, location, and loudness like they're analyzing a jazz composition, because all those details help determine if you need to worry or if you can go back to binge watching your favorite shows. Let me share a real example that'll put this in perspective. I had a patient named Sarah, sweet 35-year-old, who discovered a murmur during routine pregnancy screening. She was absolutely terrified, convinced something was seriously wrong with her heart. After a thorough evaluation, we found it was completely innocent. Just her body's increased blood volume from pregnancy creating that extra whooshing sound. After delivery, we did a follow-up and her heart was absolutely perfect. Beautiful, strong, healthy heart. This perfectly illustrates why professional evaluation matters way more than your initial worry. Dr. Google is not your friend when it comes to heart murmurs, folks. The bottom line is this. Most heart murmurs are just your heart's unique soundtrack. Some hearts are quiet like a library, others sound like a gentle brook babbling. Both can be perfectly healthy. But here's your action plan, because I'm not sending you home empty-handed. If you have a murmur, ask your doctor these 3 crucial questions. Is this innocent or concerning? Do I need specialist evaluation? And what symptoms should prompt me to seek immediate care? These questions will give you the roadmap you need. Knowledge removes fear, and fear is what keeps people awake at night unnecessarily. I've seen too many patients lose sleep over innocent murmurs, and life's too short for that kind of stress. Remember, your heart is an incredible machine that beats over 100,000 times a day without you having to think about it. Sometimes it makes a little extra noise, and most of the time that's perfectly normal. But when in doubt, get it checked out. Better safe than sorry, and your peace of mind is worth its weight in gold. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy. And remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.